Hi, welcome to Health Matters. My name is Sherry Gallant. I'm with Alberta Health Services, and today we're talking with Kristen Griffiths. Kristen is a dental hygienist with Alberta Health Services Oral Health Program, and just recently in April it was Oral Health Month, and I hear that we have some new regulations that have come out about fluoride. Can you tell us about that, Kristen?
Yes, Sherry. So actually there are new regulations, new guidelines that follow the old guidelines. So now we're going back to recommending fluoride toothpaste, which is safe right from the first tooth. So a few years ago we switched it to water only until the age of 3, but now we're going back. So from first tooth, a right-sized amount of fluoride toothpaste can be used to brush children's teeth twice a day. Now I'm going to show you what a right-sized amount of toothpaste looks like, because it's really not a lot. Most people use too much toothpaste, adults as well, but especially children. You get this yummy flavored toothpaste and they just want to eat it. So it's very important that parents are putting the toothpaste on for their children and not allowing them to do it themselves. So if we've got a child-sized toothbrush here, and we're literally just putting on a smear or a rice-sized amount. So that's what it looks like on a toothbrush, and we have some pictures here as well, just to show what the difference is. So from first tooth to the age of 3, the right-sized amount, and then after the age of 3, or when the child is spitting really well, you can use up to a pea-sized amount. And honestly, Sherry, that's all you and I need to.
Okay. Yeah, we don't want overkill.
Exactly. Too much toothpaste isn't always a good thing, right? And especially children are more at risk of swallowing it if they have too much toothpaste on their toothbrush.
And swallowing it is not good. Why?
The toothpaste is made to be spit out. It's made to protect the teeth topically, so put on the teeth. So there's lots of ingredients in it, the stuff that makes it bubble and other things that aren't meant to be swallowed. I always tell children that toothpaste is for the teeth, not for the tummy.
Oh, good advice. Okay, so when we have our first child and that first tooth comes through, and maybe some more after that, maybe we're nervous about how to brush their teeth. Can you give us a little demo?
Absolutely. So the biggest thing is using a soft toothbrush and using the right amount of toothpaste. You want to make sure that you're brushing all surfaces of the teeth. Sometimes children will get their front teeth first, and then they'll get a back tooth, a molar. So you got to make sure that you're checking all the way around the mouth and getting all of the teeth that they have. The number one place that people miss is the tongue side. So this model doesn't have a tongue, but you can imagine it would be sitting at the bottom of the mouth, and you want to make sure you're getting the tongue side where the teeth are there, because the tongue often covers that up, and that's where a lot of food can stick. Yeah, so the bottom jaw, it acts like a bowl, and that's where our saliva and food sticks to. So making sure we're getting the outsides and the insides. Most people, they close their mouth and they brush those front teeth really well. Well, that's not the place that we're missing. So the insides, the top surfaces where food can get stuck in the grooves of the teeth, and don't forget to brush your tongue.
That's what I was just going to ask you.
Yeah.
What's the proper technique for that?
So I always tell people to start at the tip and start with the toothbrush flat, especially if you're brushing someone else's tongue, like your child's. Never start further back, because then you're just setting yourself up for disaster. So start at the tip, moving forward, moving that food and bacteria forward, going back as far as you can handle until that gag reflex kicks in, and then you can stop.
Right. Choking's not good.
No.
Okay, and every time you brush, you should be brushing.
We do recommend it, and that's where you can get really bad breath or halitosis from, is from the tongue. Bacteria can hide there, and you can often notice discoloration of the tongue, especially when kids have just had a Slurpee or a sucker. You can see the color on their tongue, so it's important to brush that. Yeah.
Okay, and like you've mentioned, fluoride is not meant for tummies.
Right.
So is it important to maybe practice some safety around where you store your toothpaste?
Absolutely. Like I said earlier, if a child gets a hold of the toothpaste and they can go and do it on their own, they often put on too much, or sometimes, especially the little ones, they might just try to eat the whole tube of toothpaste. So we recommend that parents put the toothpaste on, but that they also keep it hidden in a shelf far away from the child's reach. Just like most things that you don't want them to get their hands on and take too much of, you just want to keep it out of their reach.
That's really good advice, because we may not tend to think of toothpaste as a hazard.
Right. Absolutely.
Any other tips that you can give us for, because we just finished Oral Health Month, but that doesn't mean we should forget about oral health.
Absolutely. We have our teeth. I always tell kids till you're 100 years old, so it's important to brush them every day. We recommend at least twice a day or more now, especially for children, as they often don't brush for the full 2 minutes each time. So we recommend, if they're in school, trying to get them to brush when they get home from school, because they've had snack and lunch and, you know, sometimes treats on special occasions. So if you can get them brushing in the morning, after school, and then at night before bed, that is the best recommendation. And then for at least 2 minutes. Even as adults, if we're not being monitored, we tend to do a quick brush, and then we're not reaching all the areas of the mouth.
So I heard once that maybe you could hum a song, like Happy Birthday would maybe be 2 minutes?
I do with my niece. I go, I brush my teeth. So we get kind of getting her excited about brushing, and then they can get those little timers that have the sand, and that really helps kids to understand how long 2 minutes is, because in a child's mind, you know, 10 seconds feels like 2 minutes sometimes. And it honestly, it works for adults too.
It's fantastic stuff. Thank you so much.
Thank you, Sherry.
Thank you very much for watching. This has been Health Matters.